Hi, everybody. Welcome to this workshop on applied survey development for nurses. My name is Juan Cabrera. I'm going to be leading you through the workshop over the next two sessions. And in the interest of time, we're going to jump straight into it. So a good place to start is discussing what exactly is a survey. A survey is a broad term. It encompasses various data collection methods to gather information from a group of respondents. The primary purpose of a survey is to collect data systematically and then analyze and interpret this data to draw conclusions. Surveys can utilize different methods such as questionnaires, interviews, and observations to collect the required data. They are particularly useful for making inferences about a larger population based on the responses from a sample. And the reason why we need to define surveys is because we need to differentiate with a common misconception that it is interchangeable with questionnaires. A questionnaire is a specific research tool that consists of a series of questions aimed at collecting data from respondents. The primary purpose of a questionnaire is to collect specific data points, which can include opinions, behaviors, or factual information. Questionnaires are often used as a component of broader surveys and can be administered in various formats, including paper-based and online formats. They provide a structured way to gather consistent information from multiple respondents. For example, you might use a patient satisfaction questionnaire to gather feedback on their hospital stay experience. Questions could range from how would you rate the cleanliness of your room to how would you rate the friendliness of the staff? Another example could be a staff feedback questionnaire to understand the effectiveness of a new training program. Questions might include how confident do you feel in applying the new procedures? Or what improvements would you suggest for future training sessions? These questionnaires allow for the collection of specific data points that are crucial for making informed decisions and improving practices. Now that we define what a questionnaire is, understanding the difference between surveys and questionnaires is fundamental when designing your data collection tools. Although they serve related purposes, they differ in scope and application. Surveys have a broader scope and can include multiple methods of data collection, such as questionnaires and interviews. The primary goal of a survey is to gain general insights and draw conclusions about a population. For example, a hospital might conduct a survey to understand overall patient satisfaction. This survey might include a variety of questions and methods to capture a comprehensive view of patient experiences. The insights gained from a survey can help identify trends, inform policy decisions, and highlight areas needing improvement. On the other hand, questionnaires are a more focused set of questions used within surveys to collect specific data points. They are designed to gather detailed information on particular topics. For instance, within the broader patient satisfaction survey, a questionnaire might be used to delve into specifics about the cleanliness of the facilities or the friendliness of the staff. Questionnaires are precise tools that help collect targeted information, making them essential for detailed gathering. To illustrate, think of a survey as a toolbox and questionnaires as individual tools within that box. The survey encompasses all the tools and methods you need to gather a wide range of data, while the questionnaires are specific tools you use to gather detailed information on particular aspects. While surveys provide a wide lens to view the population's overall perspectives, questionnaires offer a zoomed-in view to understand specific details. For example, a survey might include sections on patient care, facility amenities, and overall experience, using different questionnaires for each section to gather in-depth data. Let's look at another example. Suppose you want to understand the work environment for nurses in a hospital. A survey might be used to collect general feedback about job satisfaction, work-life balance, and workplace culture. Within this survey, a questionnaire might focus specifically on job satisfaction, asking detailed questions about workload, support from management, and professional development opportunities. We also need to understand why we use surveys in the first place. Surveys are powerful tools for gathering information quickly from a large number of people. They can provide standardized data that's easy to analyze and compare. Some of the key strengths of surveys include their wide reach and accessibility, and this allows you to collect data from a broad audience. Surveys also enable standardized data collection, which helps in comparing results across different groups or time periods. Surveys are particularly useful for tracking changes over time, as they can be repeated to measure shifts in opinions or behaviors. Additionally, they're cost effective, especially when conducted online. However, Surveys do have limitations. Responses can be biased due to poorly designed questions or respondent misunderstandings. The design of the survey needs to be clear to avoid confusion and ensure accurate data collection. Achieving high response rates can be challenging, especially if the survey is lengthy or complicated. Furthermore, while surveys can collect quantitative data effectively, they often have limited depth of qualitative insights compared to methods like interviews or focus groups. For instance, a hospital might conduct a patient satisfaction survey to gather data on overall patient experience and identify areas for improvement. The survey might include questions on various aspects of the hospital stay, from the quality of care to the cleanliness of the facilities. Another example is using surveys to track changes in staff morale before and after implementing some new policy. By regularly surveying staff, the administration can monitor the impact of changes and make necessary adjustments. And the ultimate purpose of this workshop is to learn how to design these surveys. When designing a survey, one of the most critical steps is to consider your target audience. Understanding who you're surveying is essential because different groups have varying needs and perspectives, and this will influence the type of questions you ask and the way that you ask them. First, identify your target audience. Are you surveying nurses, patients, or any other group? Each of these groups will require a different approach. For example, when surveying nurses, you might need to include more technical details because they are familiar with medical terminology and clinical processes. But on the other hand, if you're surveying patients, you will need to scaffold your language and provide a more simpler explanation to ensure that they understand the questions. For instance, when surveying nurses, you could ask, how effective do you find the new electronic health record system in managing patient data? What this question uses is specific terminology that nurses will understand, and then they can provide detailed feedback on this. Conversely, when surveying patients, you might ask, how easy is it to understand your medical records? This question is much more simpler and direct. It makes it accessible to patients who may not be familiar with medical jargon. Tailoring your survey to the audience also involves considering cultural and demographic context. Different cultural backgrounds and demographics can influence how questions are interpreted. For example, certain phrases or terms might be common in one culture, but unfamiliar or even offensive in another. Always be mindful of these nuances to avoid misunderstandings and ensure that all respondents feel comfortable and respected. But before you start writing questions, you need to clearly define the objectives of your survey. What do you want to measure? Are you looking for feedback on a new process, assessing satisfaction, or gathering data on clinical outcomes? Defining clear objectives helps in structuring the survey and ensures that you collect relevant data. It also aids in communicating the purpose to respondents, and that's going to improve your response rates. There are many existing surveys that might meet your needs, saving you time and effort. Using these surveys can provide several benefits. They're often validated tools, meaning that they've been tested for reliability and accuracy. This can give you confidence in the data that you collect. Existing surveys can also save you time as the design and testing phases are already completed for you. Additionally, they tend to be reliable because they've been used and refined over time. However, existing surveys may not always fit your specific needs. They come with limited customization options, meaning that you might not be able to tailor them precisely to your context. In such cases, designing your own survey is going to be beneficial. Creating your own survey offers the advantage of customization. You can design questions that are specific to the objectives and context. This flexibility allows you to address particular issues or areas of interest. However, custom surveys require careful design to avoid pitfalls like bias and unclear questions. The process can be time-consuming and requires expertise to ensure the survey is effective. For example, you might use an existing standardized patient satisfaction survey that's been validated in multiple healthcare settings. This survey can provide reliable data on overall patient satisfaction. On the other hand, if you need to evaluate the effectiveness of a new clinical protocol specific to your hospital, you might design a custom survey. This custom survey can include detailed questions relevant to the new protocol, and this would allow for more specific and actionable insights. There are different types of questions that serve different purposes. Multiple choice questions are great for gathering straightforward data and are easy for respondents to answer quickly. Likert scales allow you to measure feelings and opinions on a scale. Open-ended questions can provide detailed insights, but these are a lot harder to analyze, whereas closed-ended questions offer specific choices, and that makes it easier to summarize your data. Understanding when to use each type helps in designing an effective survey. So let's begin discussing multiple choice questions. These questions are designed to help collect specific information quickly and efficiently. They are a staple in surveys because they provide clear, quantifiable data that's easy to analyze. For example, consider a question like, what is your age group? Here, we can offer predefined response options such as 18 to 24, 25 to 34, 35 to 44, 45 to 54, and 55 plus. This format allows respondents to quickly select the option that applies to them, making the process straightforward and less time consuming. Another example is asking about the frequency of using electronic health records with the question like, how often do you use electronic health records? The response options might be daily, weekly, monthly, rarely, or never. These predefined choices make it easy for respondents to provide their answers, and for us, it simplifies the data analysis process. The responses are already categorized so we can quickly tally the results and identify trends or patterns. Multiple choice questions are particularly beneficial in a clinical setting where time is often limited. They allow nurses to provide the necessary information without having to spend too much time thinking about their answers. This efficiency is crucial for maintaining higher response rates and obtaining reliable data. Additionally, multiple choice questions minimize the potential for varied interpretation. Since respondents choose from a set of predefined options, there is less room for ambiguity compared to open-ended questions. This standardization helps ensure that the data collected is consistent and comparable. When designing multiple choice questions, it's important to cover all possible answers while keeping the options mutually exclusive. For example, if asking about age groups, ensure there is absolutely no overlap between the categories. And if necessary, include an other option to capture any responses that don't fit the predefined choices. It's also beneficial to keep the number of options reasonable. Too many choices can overwhelm respondents, while too few might not capture the full range of possible answers. Striking the right balance is key to designing effective multiple choice questions. Now let's talk about Likert scale questions. These questions are particularly useful when you want to gauge opinions and feelings about a specific topic. Likert scales provide a range of response options, allowing respondents to express varying degrees of agreement or satisfaction. For instance, let's go back to that example about measuring staff satisfaction with a new patient care process. A Likert scale question for this might be, how satisfied are you with the new patient care process? Here, we can offer staff response options ranging from very satisfied to very dissatisfied. This way, staff can indicate their level of satisfaction more precisely than with a simple yes or no question. Another example is assessing opinions on the usability of a new documentation system. We might ask, how strongly do you agree with the following statement? The new documentation system is user-friendly. The response option could range from strongly agree to strongly disagree. Using Likert scale questions helps us understand how staff feel about changes and improvements in a more nuanced way. Instead of just knowing if they're satisfied or not, we can see the intensity of their feelings. This detailed feedback can be incredibly valuable for identifying areas that need further improvement or for validating the success of implemented changes. Moreover, the data collected from the Likert scale questions can be analyzed quantitatively. We can calculate averages, look for patterns, and identify trends over time. For example, if we see a shift from neutral and dissatisfied towards satisfied and very satisfied responses over several months, we can infer that the changes in the patient care process are being positively received. It's also important to keep the response options consistent across your survey. This consistency helps in making reliable comparisons and ensures that respondents clearly understand the choices they have. Lastly, when crafting these questions, being mindful to keep them neutral and avoid leading language, which we'll talk about more in a couple slides. But for example, instead of asking, don't you think that the new system is user-friendly? You would want to ask, how would you rate the user-friendliness of the new system? In this way, we avoid implying a certain response and allow for someone's genuine feedback. Now let's discuss open-ended questions. These questions are designed to allow respondents to provide detailed feedback in their own words. Unlike closed-ended questions, which limit responses to predefined options, open-ended questions give respondents the freedom to express their thoughts and feelings more fully. Open-ended questions are particularly valuable when you want to gather rich qualitative insights. For example, if we're assessing the new shift schedule, an open-ended question might be, what do you like most about this new shift schedule? This type of question encourages nurses nurses to share their positive experiences and specific aspects they appreciate, providing us with in-depth feedback. Similarly, if we're looking to improve the patient intake process, we might ask, what improvements would you suggest for the patient intake process? This question invites nurses to share their ideas and suggestions for enhancements, offering valuable perspectives that might not be captured through the closed-ended questions. The detailed feedback from open-ended questions can reveal underlying issues, unique viewpoints, and innovative ideas that might otherwise go unnoticed. For instance, a nurse might highlight a specific challenge they faced during the patient intake that could be resolved with a simple change, or they might suggest a new approach that could streamline the process that they'd necessarily wouldn't be able to provide you with if choices were fixed on a survey. However, while the responses from open-ended questions are rich in detail, they do come with a trade-off. Analyzing these responses can be more time-consuming compared to closed-ended questions. Each response needs to be carefully read and categorized, often requiring thematic analysis to identify common trends and insights. Despite this, the benefits of open-ended questions often outweigh the additional effort required for analysis. The qualitative data they provide can add depth and context to the quantitative data collected through other question types, offering a more comprehensive understanding of the issues at hand. When crafting open-ended questions, it's important to make them clear and specific to guide respondents in providing relevant feedback. For example, instead of asking a vague question like, what do you think about our services? You could ask, what improvements would you suggest for our patient intake process? This ensures that the feedback you receive is focused and actionable. And lastly, let's look at closed-ended questions. These questions provide respondents with specific options to choose from, making them easy to answer and analyze. Closed-ended questions are excellent for getting clear, straightforward answers that can be quickly summarized. For example, the question, do you prefer electronic or paper records for patient documentation? The response options could be electronic or paper. There's no ambiguity there. This ensures that respondents can select their preference easily and that the responses are straightforward to analyze. Ultimately, this makes the data collection process more efficient. Another example could be asking, have you attended any of the recent training sessions on patient safety? And here the responses are yes or no. Again, this closed-ended format provides clear answers that are easily interpretable, and you can tally them as well. We can quickly determine the percentage of nurses who have attended training sessions, which helps us assess the reach and effectiveness of our training programs. Closed-ended questions that are particularly useful in surveys where quick, easy to summarize responses are needed. They reduce the cognitive load on respondents, providing predefined options, which helps maintain high response rates. This is especially important in busy clinical settings where time is limited. Additionally, closed-ended questions standardize our responses, making it easier to compare and aggregate data later. This consistency is crucial for identifying trends and drawing reliable conclusions. For example, by consistently asking about preferences for electronic versus paper records, we can track changes in preferences over time and make informed decisions about documentation practices. However, when designing closed-ended questions, it's important to ensure that the response options are exhaustive and mutually exclusive. This means covering all possible answers while avoiding any overlap. For instance, if asking about frequency, the options should be clear and distinct, such as daily, weekly, monthly, rarely, or never. Let's shift gears into measuring change over time. Pre and post surveys are designed to assess the impact of specific interventions by comparing data collected before and after the intervention. They help in evaluating the effectiveness of a new process or training. When designing pre-post surveys, it's important to ensure that the questions are consistent across both surveys to accurately measure change. This method helps track improvements or declines over time, and this is going to provide you those valuable insights into the effectiveness of change. For example, you can use pre-post surveys to evaluate the impact of a new patient care protocol. In the pre-survey, you might ask questions like, how confident are you in managing patient care under the current protocol? And then ask the same question in the post-survey after the new protocol has been implemented. This comparison helps identify any changes in confidence levels among the staff. Another example could be measuring staff satisfaction before and after a training session. In In the pre-survey, you might ask, how satisfied are you with your current knowledge of patient safety procedures? And in the post-survey, how satisfied are you with your knowledge of patient safety procedures after the training? This allows you to evaluate the effectiveness of the training in improving staff satisfaction and knowledge. By comparing the responses from pre and post surveys, you can identify significant changes or trends that indicate the success or areas for improvement of the intervention. This method provides a clear picture of the impact of changes over time, helping you make those informed decisions about future initiatives. Consistency in question design is crucial for accurate comparisons in pre-post surveys. Ensure that the questions and response options remain identical in both the pre and post surveys, because introducing new variables or changing wording even slightly will lead to inaccurate results, making it difficult to measure true change over time. For example, consider the implementation of a new electronic health record system. In the pre-survey, you might ask, how confident are you in using the new EHR system? This question assesses the initial confidence level of the staff before they start using the new system. After the system has been implemented, you would ask the same exact question in the post-survey, how confident are you in using the new EHR system now? Using the same wording and response options allows you to directly compare the responses and measure any changes in confidence levels accurately. Another example could be evaluating changes in patient handoff procedures. In the pre-survey, you might ask, rate your satisfaction with patient handoff procedures. This question establishes a baseline of satisfaction before any changes or training are introduced. After the training, you would ask the same question in the post-survey, rate your satisfaction with the patient handoff procedures after this new training. Identical questions in both surveys ensure that the differences in responses are due to the intervention itself and not because of the variations in question wording or interpretation. But you got to be cautious of pitfalls such as using different samples for the pre and post surveys. For instance, if you survey one group of nurses before the implementation of the new EHR system, and then you survey a different group after the implementation, the results are not going to accurately reflect the changes due to the intervention itself. Differences in responses could be due to variations between the two groups rather than the effectiveness of the new EHR system. This can invalidate the results of your longitudinal study, where the goal is to track changes within the same group over time. No one should be different. Also, it's beneficial to ensure that the conditions under which the pre and post surveys are conducted are as similar as possible. This includes the survey environment, the method of administration, so online or paper, making sure that's the same each time, and then also the timing of your survey, because consistency in these factors helps reduce variability and enhances the reliability of your findings. Branching logic in survey design. This is a technique that allows the survey to adapt based on respondents' answers. And this means that the questions shown to a respondent can change depending on their previous response, making the survey more relevant and efficient. The primary benefit of branching logic is that it helps to avoid irrelevant questions. By tailoring the questions to each respondent's answers, you can reduce the length of your survey and improve the overall respondent experience. This targeted approach increases the likelihood of respondents completing the survey and providing accurate data. For example, consider a survey about EHR usage again. If a respondent indicates that they do not use EHRs, branching logic can automatically skip any follow-up questions related to EHR usage, and now instead on the patient's end, it's going to show questions relevant to their situation. This keeps the survey focused and reduces the burden on respondents. Another scenario is in patient feedback surveys. If a patient indicates that they were satisfied with their care, the survey can direct them to questions about what aspects they found most satisfactory. And if they indicate dissatisfaction, the survey can ask more detailed questions to understand the reasons for their dissatisfaction and gather actionable feedback. Now, you would implement branching logic in various survey platforms such as Qualtrics and REDCap, and we'll talk a little bit more about that. These platforms provide tools to set up branching logic rules, ensuring that respondents are guided through the survey based on their answers. For instance, in Qualtrics, you can use the survey flow feature to create paths for different response options. And in REDCap, you would use the branching logic tool. to set up conditional questions. By enhancing your survey efficiency and relevance, branching logic helps to gather more accurate and useful data. And that's going to improve respondent engagement by making the survey experience more personalized and less burdensome. Now, the wording of your questions is crucial to avoid bias. We talked about this before, but leading questions or ambiguous language can skew your results, making it important to use neutral wording. Neutral wording ensures that questions are not leading or suggestive, which helps in obtaining unbiased responses. So, for example, a biased question like, how helpful was our excellent support team, assumes a positive response and can influence the respondent's answer. Instead, you want to use neutral wording, such as, how would you rate the helpfulness of our support team? This way, respondents are not led to a particular answer, and they're going to give you their honest opinion. Now, another example of a leading question is, most people find the new system easy to use. Do you agree? This question suggests that the majority has a positive opinion, and that's going to influence the answer as well. A neutral way to ask that would be, how easy or difficult do you find the new system to use? And that format's going to allow respondents to express their true feelings without any bias. Now, complex questions can also be problematic. For instance, do you concur with the implementation of the newly devised operational procedures? That's very difficult to understand. A clear version would be, do you agree with the new procedures? Simplifying your language makes the question easier for the participant to understand and answer. To avoid bias, you need to test your questions. This involves piloting your survey with a small group to identify any bias or confusing questions. You want to collect feedback and revise your questions as needed to ensure that they're clear and neutral. Now, the order in which your questions are presented in the survey can significantly affect the quality of responses. So it's really important to consider the sequence of your questions to ensure a logical flow and maintain engagement. Start with easy and non-threatening questions. Now, these questions help to build a rapport and ease respondents into the survey process. So, for example, opening with demographic questions like, what's your age or what's your job role, can make the respondents feel more comfortable. Sensitive or complex questions should be placed later in the survey, because at this point, respondents are more engaged and less likely to abandon your survey. So, for example, questions about personal health issues or job satisfaction should be placed after some general questions. Grouping similar questions together can also maintain a logical flow. For example, group all questions related to job satisfaction in one section, and then all questions related to training in another. And that's going to help respondents organize the context of each section, and that's going to be a lot smoother of an experience. And that's going to ultimately reduce the cognitive load on your respondents. And that approach is going to help keep respondents engaged throughout the entire survey, and that's going to be leading to higher completion rates and ultimately, again, more reliable data. Before deploying your survey, it's important to pre-test it with a small group. This process is going to help identify any confusing questions or technical issues to ensure that smooth experience for your respondents. Pre-testing provides valuable feedback that can be used to refine your survey before the full deployment. And the purpose of pre-testing is, again, you want to identify and address any issues in the design from a sample that represents your target audience. This helps in understanding how the survey will be received and where improvements are needed. During the pre-test, pay attention to feedback on question clarity and neutrality. Ask your test group to provide detailed feedback on whether any questions are biased or difficult to understand. Based on this feedback, revise any biased or unclear questions to ensure that your survey questions are unbiased and clear. Well, let's go through the typical pre-testing process. You want to conduct a pilot survey with a small group, gather feedback on question clarity and neutrality, and then make those necessary adjustments based on the feedback before you deploy it. Now, long surveys are going to lead to respondent fatigue, and that's going to result in incomplete or rushed answers. And it's essential to keep your survey as short as possible while still gathering the necessary data. Now, structuring your survey is crucial to avoid participant fatigue and maintain high response rates. Start with general and engaging questions. These questions should be easy to answer and relevant to the respondents' experiences. So, for example, you might begin with a question like, how would you like to describe your overall satisfaction with our services? Starting with these general questions helps to engage respondents and ease them into the survey process. And then after engaging the participants with general questions, that's when you're going to move on to these specific questions about the particular changes or interventions you're evaluating. So, for example, how would you rate the effectiveness of the new patient care protocol? The progression from general to specific helps maintain engagement and reduce the cognitive load. Include a balanced mix of question types throughout the survey. So use a combination of quantitative questions like those multiple choice or Likert scales, and qualitative questions such as the open-ended ones to gather both numerical data and detailed feedback. And that mix is going to ensure a comprehensive understanding of the changes in outcomes. You want to place your demographic questions towards the end. Demographic questions are important, but they can be tedious for respondents. And by placing them at the end, you ensure that the respondents have already provided the crucial data related to the intervention, reducing the risk of drop-off due to fatigue. For instance, questions about the respondent's role, years of experience, or department would be included here. Clearly define the objectives of your pre-post survey. Again, these clear objectives are going to guide the design of your questions and ensure that you are gathering the necessary data. So for example, if your objective is to measure the effectiveness of a new training program, structure your questions to capture relevant feedback before and after the training. I briefly mentioned these two platforms, but I just want to make note again about Qualtrics and REDCap because they're the two most popular platforms. Qualtrics is known for its user-friendly interface and advanced features. So it's going to be best for us to work with this first. If you are new to the survey design process, it offers a wide range of question types, customizable survey templates, and powerful data analysis tools. And it's going to have those features like the branching logic, which allows you to tailor the survey flow based on respondents' answers. And REDCap, though, that's designed with the focus on academic and clinical research. It offers strong data security features, and that's going to make it ideal for sensitive data collection in healthcare settings. It's also going to be nice for project management tools, and that's going to enable you to do collaborative work on survey projects. And that's going to support complex survey designs and longitudinal data collection. There are various methods for distributing your surveys, each with its own disadvantages and advantages. Online surveys are quick and convenient. They allow for easy data collection and analysis, as responses can be automatically recorded and processed. Online surveys are also cost effective. They eliminate the need for printing and manual data entry, but they do require internet access, which we all have at this point. But while we may have access, it may not reach populations without reliable internet connections. If you happen to be interested in studying like rural participants, this may be a barrier. And that's where you can look at paper surveys. They can reach populations that don't have great internet access and provide a tangible form that some respondents might prefer. Those can be distributed in clinical settings. They can be mailed or handed out in person, but they do require manual data entry, which is tedious and time consuming, and it's very much so prone to errors. Technology is our friend, and now using smartphones at the bedside allows for real-time data collection in clinical settings. And this is particularly useful for collecting immediate feedback from patients or staff. And that's going to ensure timely and relevant responses, but it requires access to smartphones or tablets, and it's limited by respondents' comfort with technology. When choosing the best method for your project, consider your target audience, your available resources, and the context of the survey. For example, if you're surveying patients during their hospital stay, smartphones at the bedside might be the most efficient method. For a broader staff survey, an online format could be more suitable. And as we'll see in Qualtrics later, you can actually design your online survey to have a mobile version as well. So now our next steps is to put theory into practice with some hands-on activities, and we'll be working to design and modify survey questions using Qualtrics. So what we'll need to do is choose a topic relevant to your work or area of interest, design a set of survey questions or modify existing ones, and ensure your questions align with the principles that we've discussed today, including having clear objectives, neutral wording, and select appropriate question types. Remember to keep your questions clear and unbiased, avoid leading or complex questions that might confuse your respondents, and once you design or modified your questions, we'll reconvene to discuss your experiences and any challenges you've encountered. We'll see you in the next section.